Now, what precautions have we taken at all the dormitories? Since the COVID-19 outbreak, I think firstly, we tried to limit the inflow of foreign work pass holders so that we could manage the risk of imported cases. That's the first thing that we did. We reached out to all the dorm operators to remind them to be more vigilant. Then, we also produce materials in the workers' native languages to encourage them to take steps to protect themselves. Subsequently, non-essential facilities like gyms and TV rooms were closed. Meal times and recreational hours were also staggered. Intermixing between the blocks, we put a stop to it. So those were the precautions that took place. The question, of course, is why then has there been such a spread amongst the workers staying in the dormitories? From the epidemiological findings, there is evidence to link the workers in the dormitories to common work sites. Then, the workers from the different dormitories on their rest days may also gather. And so they may socialize and shop at popular places like Mustafa. Now, back in the dorms, these workers would then socialize with another group of friends. They might, cook together, eat together, relax together. So despite the safe distancing measures that were in place then in these dormitories, the virus in the dorms spread through socializing activities, much like it would spread amongst housemates, friends, and also in the community. This may explain why, all the way up to middle of March, the workers who lived in dorms that tested positive for COVID-19 were few and far between. But then, in quick succession, in some dormitories, not all, in some dormitories, many popped up. So what are we now doing to contain the spread? It is a three-pronged strategy. First, in the dorms, where there are already clusters, we will actively contain the spread. Now, it means locking down these dormitories, no more moving in and out. Workers have to stay in their room as much as possible. Minimize the interactions with other workers. Meals are provided to avoid communal cooking. And those that have to use communal toilets have scheduled, staggered shower times. We are also testing the workers to identify and isolate the infected ones and closely monitoring the health of the other workers. So that's the first prong. Second, it's useful to note that not all the dorms have clusters. In fact, 29 of the 43 purpose-built dorms and almost all the factory-converted dorms, they have no clusters. Hence, for these types of dormitories, our aim is to prevent the clusters from forming. All those in these dormitories that are tested positive and their close contacts would already have been isolated separately. While these dorms are not gazetted as isolation areas, we aim to apply the same safe distancing measures so that they are effectively also on lockdown. Likewise, the workers have to stay in the dorms. Within the dorms, we enforce strictly the safe distancing measures, which means no more cooking and freely mixing with friends from other housing units. So that's the second prong. Third, across all 43 purpose-built dorms, we have moved out or separated the workers in essential services who are still needed by their employers to go to work. This is now about 7,000 of them. We put them in separate facilities so that they do not have to enter and leave the dorms daily or interact with the other dorm residents. To provide a higher level of assurance, medical screening was conducted to ensure that the workers did not have symptoms before moving into the alternative accommodation. All the workers were screened before they moved to the alternative accommodation. In the meantime, while at the workplace or traveling to work, they are required to also implement strict safety distancing. This includes wearing a mask at all times, not interacting with other workers, and eating meals alone. And like all Singaporeans, they will be required to remain in their residences after work. We hold the employers of these essential workers responsible, and we look to them to do their utmost to keep their workers safe, even as they go about their duties. Now, what we have done to move out or separate the essential workers in the purpose-built dormitories, we will also do for the factory-converted dormitories. Move them out, monitor them, screen them, all of them. The moving out of workers from all the dormitories, purpose-built or factory-converted dorms, will help to create more space for isolation facilities within the dorms, so that we can house separately the workers who are unwell or are waiting for the results of their swab tests. So those are the 3 prongs of the strategy. Now, to implement this 3-pronged strategy effectively, there are also 3 key enablers. The first is the FAST teams that I've talked about. For all 43 purpose-built dorms, we have deployed the FAST teams, and they have been on the ground since last Wednesday, working round the clock to implement safe distancing measures. I visited some of the dorms comprising and interacted with the FAST teams, which comprised of SAF, SPF, as well as MOM officers. They understand their mission to put the well-being of the workers as the top of their priority. They sort out issues with food as well as cleanliness. They keep in close touch with the workers and attend to the feedback from the workers. They are a great help to the dorm operators, and we will soon deploy roving FAST teams to also support the employers or the dorm operators for the factory-converted dormitories. So that's the first key enabler. The second key enabler are our medical support teams at the dormitories. These are also being stepped up progressively. These medical outposts at the dormitories are supported by the regional healthcare systems, which deploy teams of doctors, nurses, and technicians to the dorms. They tend to the workers who are unwell, swab those who have acute respiratory symptoms. They manage the cases that need to be sent to other facilities, and then they will also assess if the workers are well enough to be returned to their rooms. Their presence in the dormitories give great confidence to the workers who are there. The medical teams will also work with the FAST teams to set up on-site isolation facilities. We now have 8 medical outposts set up at the gazetted dorms and aim to have medical touch points at all 43 purpose-built dorms. Now, most of the other factory-converted dorms, they are already well supported by the national network of PHPCs, the Public Health Preparedness Clinics. So the workers in the factory-converted dorms can also get timely medical attention. So that's the second key enabler. The third key enabler will be the dormitory operators as well as the employers. Now, the more the dorm operators can handle the food and the hygiene matters, the more the fast teams can focus on effective safe distancing and tackle other issues. For example, expanding the isolation facilities on site and helping the workers to remit monies home. A big part of the workers' sense of well-being is to be able to continue to receive their salaries. It's important to them. And this is where the employers have a duty to ensure that it is done so promptly in a timely manner.